is the number one thing you can do that will change the trajectory of your health, that would add years to your life and life to your years? I often get asked this question as a functional medicine practitioner, nutritional specialist, been in private practice for 30 years, specializing in complicated illnesses like fibromyalgia, chronic fatigue syndrome, and other things for the last 20 years. I'm often asked by colleagues and those in the lay public, what is the number one thing I can do, Dr. Murphree, that will help me get healthy and feel good again? And to me, the number one thing you can do is to make sure that you are consistently getting deep restorative sleep. Now, that's kind of boring for a lot of people. You hear, oh, I know I need to get more sleep. In our country, here in the United States anyway, it's almost a badge of honor to say that we only get 4 or 5 hours of sleep. You know, we're workaholics. And what we need to realize is that this deep restorative sleep is the time when the body is repairing itself. If it never gets the opportunity to repair itself, you're going to start to see that the body starts to break down. It'd be like running your car continuously for 10 years, never turning the car off. Eventually, that thing is going to wear down. You're going to start seeing some warning signs. Oil light's going to come on, you're going to see the engine light. Whatever it is, you're going to start getting some warning signs or some symptoms that start to show up to alert us that we've got some potential problems that are brewing that need to be taken care of. It's the same thing with our bodies. And if you think about it, if you don't get a good night's sleep, obviously the next day you're going to be tired. You're going to be lethargic. You're not going to think as clearly. So your mental clarity may be off. If you're not getting a deep restorative sleep, you increase the risk for type 2 diabetes. You increase the risk that you sabotage your metabolism, so you might start gaining some weight. The stress of not getting a good night's sleep on a consistent basis can then start to lower your immune system. Your immune system can be compromised. You can develop a thing called adrenal fatigue, where your stress coping glands, the adrenal glands, have become under so much stress, not getting the opportunity to rest themselves at night, that now they start to become sabotaged, and you see that you're not producing enough cortisol or DHEA. And so you might start having problems with low energy or low stamina, resistance to stress. As you're not getting enough sleep, you see that you start to deplete certain nutrients that your body needs to help you deal with stress. So you can start to deplete certain brain chemicals like serotonin, which is the happy hormone. When you start getting low in serotonin, you might start to be more depressed or feel anxious. Increases your risk for irritable bowel syndrome. You have more serotonin receptors in your intestinal tract than you do in your brain. So if you're starting to become deficient in these stress coping hormones and nutrients, the body starts to have warning signs or symptoms to alert you to that fact. If you don't get a good night's sleep on a consistent basis, you're going to see your inflammatory chemicals go up by 40%. Now, most people have already got some type of inflammation going on in their body. Stress and inflammation are two drivers of all diseases, whether that's heart disease, cancer, type 2 diabetes, you name it. Stress and inflammation are the two drivers for that condition, including autoimmune disease, fibromyalgia, and other things. So if you already have inflammation and you're adding fuel to the flames of this inflammation by not getting enough sleep, you're setting up the environment for poor health. So I want to encourage you to start to pay attention to your sleep habits. Start to pay attention to the necessity that you this is something that's not an option, really. If you want to be healthy, to look healthy, feel healthy, have a vital, long life, I want to encourage you to put the emphasis on getting a good night's sleep night after night after night. It's important that you develop good sleep habits, getting to bed on time before 11 p.m., using blue blocking glasses. We've got some tips for you at my website, superhealthyhuman.com. Look under the sleep condition protocols there. You'll see that on the superhealthyhuman.com website. But it's important that you do the things necessary to help you wind down so you can get in bed, and rather than laying there thinking, oh my gosh, I'm not going to be able to fall asleep, you've already taken the steps necessary to wind you down to get you ready for bed. For those of you that have trouble falling asleep, if you've experimented with melatonin, which I'm a fan of, the sleeping hormone, you can buy that over the counter. I recommend my patients anywhere from 3 to 12 milligrams of melatonin. It's very safe to use melatonin, but you can certainly experiment with melatonin if you're having trouble. And preferably you take sublingual melatonin that you put underneath the tongue, let it dissolve and let it work. But take that 30 minutes before bed. Oftentimes that will help you fall asleep quicker and sleep through the night. If you're having trouble winding down, you just can't turn your mind off. You get your second wind, like a lot of people at bedtime, maybe been tired all day, but then about 9 p.m. you get your second wind and you're ready to go. Now it's time, you start doing all the things that you couldn't do earlier in the day. And then before you know it, it's 1 or 2 o'clock, and you in the morning before you get in bed, now you have self-sabotaged your circadian rhythm, your sleep-wake cycle, and you throw that off, and then you get in this pattern of going to bed really early in the morning instead of later at night. You're going to bed at 1, 2 o'clock in the morning, and either getting up really early because you have to because of work, and you further deplete your body's chemicals that should be being deposited, should be being made as you get that rejuvenating sleep. But if you're having trouble winding down, there are natural things you can take over the counter, like GABA, gamma-aminobutyric acid, L-theanine, hops, valerian root. There's all sorts of things. My patients use a product called Delta Sleep that I developed over the years. It's designed to help you calm down before bed. It works within 15, 20 minutes after you take it. It can be combined with melatonin. It can be combined with sleep medication if you need to. But they use that to really calm them down to be able to fall asleep quicker. If you're like me, a recovering insomniac, the thing that always got me was I could always fall asleep, but I couldn't stay asleep. And I'd wake up 2:30, 3 o'clock, thinking about everything I had to do that day, everything I should have done the day before, typical type A. And I would lay there for an hour or so and finally be able to go back to sleep. But I am an early riser too. So I usually get up between 5:30 and 6:30 in the morning. So if I'm laying there from 3 until 4, I'm just not getting enough sleep, and it would take its toll on me. Delta Sleep's this supplement that I developed, and again, you can find something similar, I'm sure, but the way that I put this together was the only thing that really worked for me across, consistently. So typically I take Delta Sleep, which is a combination of some of these herbs that I mentioned earlier and amino acids, and it allows you to be able to fall back to sleep within 10 or 15 minutes after you take it. It won't make you feel dopey, hungover, or sleepy the next day. Again, it can be combined with other prescription medications if needed. But no one has a sleep drug deficiency. Don't stop your medications, but just know that no one has a sleep drug deficiency, and sleep drugs increase your risk of mortality, death by all causes by 500%. Not to scare you, just to point this out. So it encourages you to start looking for some other options. You can learn more about good sleep habits and my sleep protocols at superhealthyhuman.com. So check that out at superhealthyhuman.com.